Day number 14 at the 27-day mobility challenge here at the Reprogram. We are about halfway through our journey, our challenge. And again, we're carrying on with these prerequisites. We're looking for the minimal requirement for joint range of motion necessary for you to have at least a minimal injury risk, a reasonable degree of safety when participating in physical activity, an intense training program, whatever, any kind of regimen that you are trying to participate in or that you are working your way through in order to better yourself, increase your well-being, increase your health, build some muscle, anything. The body requires a certain amount of movement to allow you to do that, right? And the trouble is, in today's world, a lot of us are sat at desks, sat in cars, and then when we're not doing that, we're sat down with family, friends, and we're just not active enough, and we spend so much time in these sedentary positions that we lose that minimum requirement, and that's where all these chronic pains and problems are coming. Okay, so we did shoulder flexion and external rotation yesterday. We are now moving on to the essential range of motion necessary for extension, shoulder extension and external rotation. Okay, so this is kind of a prerequisite, if you like, a test that I would use if someone was suffering from shoulder impingement. This is a very, very common injury. When we're missing extension and particularly that internal rotation angle, we see a lot of subacromial impingement. We see rotator cuff tears, strains, similar to yesterday. And then when we lose that extension or flexion, we get a lot of that compensation going to the lower back, where we get ligament strains, muscle strains, lower back pain in general, particularly the kind that when you sort of find yourself after you finish the activity, you get that lower back pain, or when you wake up in the morning, okay, from being sedentary all night. All right, so I'm going to show you the modified version of the prone shoulder extension test. Don't need any equipment, and you can do this at home to see whether you have the necessary shoulder range of motion. And I'll show you that now. All right, this is the shoulder extension and external rotation test, okay? So this is a prerequisite to test to see if you have that compensation space necessary should you be forced into an unwanted position, to make sure you have that range of motion necessary to reduce the risk of injury and reduce the degree of damage as well. If you were to get injured, it can be the difference between having a muscle strain and a complete tear. Okay, so this is, as mentioned, this is a modified version of the prone shoulder extension test. In physical therapy, we'd put you on the bed, lying face down, and then lift your arm up behind you to measure that external rotation angle, that extension angle, sorry. And of course, at the Reprogram, we like to go one better and kind of load the tissues a bit more, have you do it so that you get more biofeedback into where your restrictions are, how that tightness feels on you. And also, we don't want to do one arm, we want to make sure it's two arms. And what that does is it biases out, places all that emphasis on the shoulder joint. If we just do one arm, we find that our body tries to wriggle away from those restrictions, and we don't get the same biofeedback. Okay, so this is the test, this is how it's done. So what you'll do is you basically sit with your hands hip width apart, fingers facing backwards, much like the table active mobility drill we did before. And you're basically going to have your feet here. You are going to shift your body forwards until your lower back touches the floor. Okay, from here, you're going to put your legs out straight, and that is the test completed. Okay, so if you can get your lower back on the floor, that is a pass. Well done. You have that essential range of motion. You have that good thoracic mobility, and it's likely that you'll be able to retract the shoulders like I'm doing now. Okay, that's a very good active sign in terms of your shoulder extension range of motion. If it's a fail, what you'll see is they will not be able to get this lower back on the floor, and it will really bother. Some people get really bothered with the straight elbow work, okay? But mainly you're going to notice it with the lack of shoulder extension mobility, because the lower back will not hit the floor. All right, so that's what you're going to see. They'll try and get that far, and they'll really be hunched over the body. It'll be really, really feeling that stretch across the front compartments here. And that is the test. Okay, so thanks for listening. If you like what I'm talking about, if you like what I'm doing, you're getting more interested, check us out at www.thereprogramonline.com. We'll see you there. See you tomorrow. Check this out.
Hi there, I'm Andrew Graham, founder of the Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine a life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.